My name is Mr Adam Shakir. I'm a consultant ENT surgeon and I am based here at OSC Healthcare in Hemel Hempstead. I look after people with any sorts of ear, nose or throat complaints. Hay fever is a common condition that affects many people in the population. It usually starts around April time and can go on into late summer into early autumn. People can be allergic to different types of pollen. Say some people are more allergic to tree or grass pollen and such like. So depending on what you might be allergic to, you might have different problems at different time of the year. People commonly describe to me that the problems that they experience with hay fever include itchy eyes, red eyes, watery eyes. And with regards to the nose, for example, they have a blocked nose. With that you can get poor sleep, poor quality of voice, a snotty nose, blocked nose, poor sense of smell. And with the throat you get sensitive or scratchy throat, sometimes some difficulty breathing, which can be a nuisance, and it is mild but can be quite troublesome as well. For those with asthma, for example, they can often find that their asthma is worse during this period as well. And in the first instance, your GP will be able to give you lots of sensible advice. So sensible things, for example, would be washing your hair when you come in from a day out, or changing your clothes. You might have lots of pollen with you, and you don't want to bring that into your house and into your bedroom where you sleep with it all night. In addition to that, you might want to consider using some simple eye drops or simple nose sprays, salt water sprays, just to clean out your nose. In addition to that, using a nose steroid spray is very helpful. Like with taking antihistamine tablet, it's best if it's taken daily for a long period of time, not just on a bad day. Beyond that, there are more novel techniques such as immunotherapy, which aim to offer a cure for hay fever, but it depends on which type of pollen that you might be allergic to. At OSC, I commonly see people who have problems with hay fever. For those individuals, I try and go through their technique with them and what they're currently taking, what sprays, what tablets. Is there something that's more effective that's available on prescription? So lots of things are available over the counter, but some of the more effective medications which might work for some people might need a prescription for that. In addition to that, as an ear, nose and throat surgeon, I can examine your ears, nose and throat and see if there are any other problems which might be contributing to your hay fever being bad for you. In addition to that, we can do some allergy blood tests as well, so we can identify what you might be allergic to, and it might not be what you think it is actually. People find it most useful to come and consult with specialists, for example here at OSC, when they find that the management or the control of their hay fever issues isn't quite what they'd like, and perhaps they'd reached the ceiling or the maximum what they can achieve with them and their GP. So at OSC, with a specialist review, we can examine your nose and offer you advice as to what can be done further for your nose, whether it's different types of medication, testings or some minor operations for your nose.